Good evening. Welcome to Gateway Community College's Nursing News. Today we're discussing sleep disorders. Sleep disorders are very common among those in the population. There are several types of sleep disorders, and currently, according to the National Center for Sleep Disorders, as many as 40% of Americans have trouble sleeping. Last week I received a video message from depicts Snoresmore, who's ticked off about her husband snoring, and is asking how to handle it.
Help, my husband snores a lot. He keeps me up of all hours of the night, and then in the morning he's fatigued. He never gets off the couch because he's so depressed, and I never get enough sleep. I have to work during the day. Look at me. I can't even go to work looking like this. I have to use a lot of makeup to cover up these saggy eyes. Help me. Somebody help me, please.
Our on-staff nurse recommended that Mr. Snoresmore see his primary care physician and ask about being evaluated at a sleep clinic. According to the National Sleep Foundation, 1 in 5 people suffer from sleep apnea. Mr. Snoresmore visited the sleep clinic and was assessed for his condition. During his visit to the clinic, he was diagnosed with obstructive sleep apnea. Mr. and Mrs. Snoresmore worked with the sleep clinic's registered nurse, Catherine, to develop his plan of care. Last week, Catherine joined us to discuss her role in the care of Mr. Snoresmore. Hi, Catherine. Can you tell me about the nurse's role when a patient comes into the sleep clinic for the first time?
Yes, I'd be happy to, Holly. Patients like Mr. Snoresmore usually come into our clinic seeking help for various sleep disorders. My role as a nurse begins with the health history to assess and identify the reasons or causes for the patient's visit to the clinic and to help form their plan of care. We conducted a diagnostic sleep study on Mr. Snoresmore and evaluated his sleep and the degree of dysfunction. This included an assessment of his sleep habit, intensity, and duration of the problem, as well as signs of fatigue and/or depression. With this information, we were able to plan his care to meet his goals to establish more restful sleep. One of the collaborative interventions of his nursing diagnosis of disturbed sleep pattern is the use of a CPAP machine prescribed by his doctor.
Today, Leslie has gone on site with Mr. and Mrs. Snoresmore and registered nurse Catherine, where they are learning about sleep apnea and the use of a CPAP, or continuous positive air pressure machine.
Hi, I'm Leslie, and I'm here at the Gecko Sleep Clinic with Catherine, who's wrapping up her return demonstration with Mr. and Mrs. Snoresmore on the use of the CPAP machine.
Thank you, Leslie, for being here.
Our viewers are very interested in sleep disorders. What's the common reason why someone like Mr. Snoresmore would need a CPAP machine?
Well, a CPAP machine is very useful for those whose airway is blocked due to being obese, perhaps even a genetic disorder. Snoresmore, I'd like you to go ahead and demonstrate the CPAP machine according to the techniques that I taught you yesterday.
Okay. Is this right?
Yes, this is correct. However, we do need to go ahead and tighten up the straps. Very good. And we would, of course, want to make sure that there was a good seal and when the machine is turned on, there is no leakage. Okay, do you feel anything leaking out? Any air?
It sounds good.
Okay, excellent, thank you. Mr. Snoresmore, could you please explain to me why the doctor prescribed CPAP to you?
Well, yeah, over the past few years I've gained a lot of weight. Well, it seems like overnight, and it happened really over the years, but as I gained weight, it put a lot of pressure on my airway and made my airways collapse.
Okay, and can you please go ahead and talk about some of the goals that we had already established?
Well, one of the goals that we came up with was that I would lose 5 pounds a month over the course of the next 8 months. I also have to have a different type of sleep pattern. I have to adjust my sleep pattern to where I go to sleep the same time each night. And I can't stay up late and watch court TV like I used to. Sorry, honey. And I also can't drink sodas or anything at all like that, anything with caffeine in it at night.
And don't forget that sleeping journal I recommended to you.
Yeah, I know I'm going to have to do that, but I haven't done it yet. Sorry, again.
And also family can be incorporated in helping you attain your goal by eating more healthy as well, and getting to a good exercise regimen.
So I have one question. Will this machine keep me up at night? Is it loud?
Well, Depravita, that's an excellent question with your sleep deprivation. Have you noticed that the machine's been on? Have you heard anything?
Oh no, I haven't heard anything.
Okay, The machine has been on and it's very, very silent. So I think you'll be able to get back into a good sleeping pattern yourself.
That's great.
Excellent.
Stop scratching.
Sorry.
Okay, Catherine, I want to thank you and Mr. and Mrs. Snoresmore for allowing us to be here today. I think with what you've shown us and taught us today, we'll all have a better night's sleep.
I agree.
Back to you, Holly.
Thank you, Leslie. Well, that's all the time we have for today. If you would like more information on sleep disorders, visit our wiki, where sleep disorders are discussed in detail. This has been the Tuesday edition of Gateway Community College Nursing News. Join us next week. We'll be discussing how to prevent test-induced flatulence. Stay classy, geckos.